And that is the other conversation that we hear today is from back home. And that's about Obamacare. We just spent several weeks back home in the state working. And I personally spent the last 3 weeks touring our state from Hayhire to Hiawassee. And I can tell you this, I get one question out of every group to which I speak. And that is, what can be done about Obamacare? My premiums are going up, my insurance was canceled. It said that I could have my doctor, I could keep my doctor if I wanted to. It said I could keep my insurance company if I wanted to. And yet I've lost my doctor and I'm losing my insurance. I really believe that this is a very, very critical issue that we need to talk about. Americans have never settled for failure, and they accept that right now, people are saying that we need to accept Obamacare, that it's the law. And yet I'm telling you, it's collapsing under its own weight. In 4 decades of business, I don't think I've ever seen anything as perverse as Obamacare and the effect it's having, not only on our business community, but on the people back home. We're still talking Obamacare today, Mr. President, because it's a complete disaster. It's failed the very people this president and the Democrats in this body claim to champion, the working men and women of America. It did nothing to go after overall cost and the spiraling nature of healthcare costs, which continue to explode and are the #1 driver of the fact that in the next 10 years, unless we do something, this president has a budget that will add $10 trillion more to our current debt. It did nothing at all to deal with the number of doctors in this country. It inserted government between patients and their doctors and created a shortage of doctors. Right now, we're averaging around 10,000. We're losing about 10,000 doctors a year, Mr. President, under Obamacare. In fact, projections show that a doctor shortage in just the next 10 years could top 90,000 doctors. That's staggering. It raises taxes, it increases premiums, and it choked out our choices. Not only that, but deductibles are up dramatically. And my home state of Georgia is feeling the weight of this failure. United Healthcare and Cigna are leaving Obamacare exchange at the end of the year. Last month, Aetna announced it was joining them. Mr. President, at the start of this year, this is an astounding number. 119, now we have a lot of counties in Georgia, 159 counties. But at the start of this year, all 159 counties had at least 2 carriers to depend on. Now, this is just after 9 months, only 96 of the 159 counties in Georgia have one option. 96 of the 159 only have one option. Georgians are being robbed of health care choices. They're also facing even higher premium and deductible costs. Premiums have risen in Georgia by an average of 33%. Every provider left in Georgia is raising premiums by double digits this year. I'll just highlight a couple of them. Blue Cross Blue Shield, 21%. Alliant, 21%. Ambetter, 13.7%. Kaiser, 18%. Harkin Health, 51%. Humana, 67%. In 2009, President Obama railed against fewer choices. While selling Obamacare, he said, and I quote, "In 34 states, 75% of the insurance market is controlled by 5 or fewer companies. And without competition, the price of insurance goes up and quality goes down," unquote. Well, gee, it sounds like he knew what was coming, except he was complaining about that at the time, and today it's gotten worse. That's exactly what's happening in Georgia because of Obamacare. And these problems are not limited to just Georgia, Mr. President. Aetna is leaving 10 other states as we speak. Today, 31% of all counties nationwide, comprising almost 2.5 million Americans enrolled in Obamacare exchanges, are more likely than not to have just one provider. That's what the president was complaining about in 2009. Insurance companies across the country are facing hundreds of millions in losses. It means fewer choices and higher costs for patients. The GAO recently reported that the pre-Obamacare plans available in most states were more affordable and had lower deductibles than the options now available in Obamacare exchanges. Profound. Nationally, premiums have risen by an average of 26%. Deductibles have risen for individuals with an average income of more than 60% than when Obamacare became law. 60%. Premiums are up 26. Deductibles are up over 60. There's no way around it, Mr. President. Obamacare is a Washington takeover of our health care system. that isn't working for average Americans. When they were talking about this back in the day, my comment all along was, well, how do you feel about Obamacare? I said, well, if you like the way the VA is being run, you're going to love Obamacare. Well, those words are coming true today. It's collapsing under its own weight. And it's failing the very people that the other side claims to champion, the working poor and the working middle class of our country, who are bearing the burden of this nonsense. Monopolies are festering and prices have skyrocketed. As I said, Obamacare is yet another example of liberal policies failing the very people they claim to champion. The diagnosis is in. None of these problems are going away. That's our problem. In fact, they're getting worse. Obamacare cannot be allowed to stand. This is not a question of tweaking it around the edges. It's profoundly built incorrectly. We have to repeal the individual and poor mandates and pass an alternative that goes after real drivers of spiraling healthcare costs. Instead, we should offer transportability, insurability, and accessibility, all the things that were missing prior to Obamacare, but have been proposed fixes have been in for over 10 years on the Republican side. Accessibility is one of the main things to those who want to purchase coverage without mandating it. This will ensure no one is priced out of the market, including those with pre-existing conditions. We should offer more access to health savings accounts to help drive down costs and allow for the purchase of insurance across state lines to increase competition. And finally, Mr. President, we've got to address the frivolous lawsuits that have forced some doctors to practice defensive medicine out of fear of being sued. All these steps are within our grasp. So don't believe those who say there isn't an Obamacare alternative out there. My friend and Georgia Representative Tom Price has championed House Bill 2300, the Empowering Patients First Act, for years. It contains all the solutions I just mentioned and more. And I'm proud to co-sponsor that with John McCain in the Senate. Our healthcare system is too important for too many Americans and too many to settle for this failure. I wasn't sent to the United States Senate to settle for the status quo. And I want to say one thing in closing, Mr. President. In the last 8 years, we've been told over and over again that the status quo is the new norm. Well, this is one where the American people are telling me and telling you that they're not accepting this new norm.